And with that, note for the record, there's a copy of the Open Meetings Act here in the room somewhere. It's not traditionally, it's traditionally over there, but it's here in the room. And with that, we'll go roll call.
Wade,
Here.
Festerson,
Here.
McNally, Rogers,
Here.
Weiss,
Here.
Jones, Wilkin,
Here.
King, Espinoza.
We'll go to item 2, which is approval of the minutes from the July meeting. Is there a motion to approve the minutes?
So,
Motion by Wade, is there a second?
Second.
Second by Wise, roll call.
Wilkin,
Yes.
Wade,
yes.
Rogers,
Yes.
Jones isn't here, Weiss,
Yes.
Espinoza, Festerson.
Yes.
We'll go to approval of the action items. There's items A through H. Is there anything anybody needs to be removed? If not, I'll ask for motion to approve items A through H.
So moved.
It's a motion by Wise, is there a second?
Second.
Second by Wilkin. Roll call.
Festerson,
Yes.
Rogers,
Yes.
Wilkin,
Yes.
Espinoza,
Yes.
Weiss, Wade.
Yes.
We'll now go to item 4 in presentations, and item A, the. Oh, okay. Item A, the Children's Nebraska Community Benefit Report. Ladies, thank you for coming.
Sorry.
Well, good morning, everyone. My name is Jen Benson. I am the manager for community benefit and engagement at Children's Nebraska. Joined with a few colleagues today. Holly Dingman, who is our director of community health and advocacy, will do another part of this presentation as we go on a little while. And then I'm also joined with Megan Connolly, who's our Vice President of Ambulatory Services and Community Outreach, as well as Melanie Thornton, who is our Government Affairs Director. So thank you for having us today. We are here to talk about community benefit and engagement at Children's Nebraska. I'm just working on advancing the slides. Okay, so we have a few things to share with you today. We'll start with sharing our 2024 community benefit expenses, which is our most recent report, as well as a few highlights for community engagement, some updates on our implementation strategy plan, and then an update from our Behavioral Health and Wellness Center. And we'll start with the community benefit expenses. So in 2024, Children's had $232.9 million in community benefit expenses overall. That represents 33.9% of our operating expenses. You can see here we divide our expenses to report them into two big buckets. One is broader community health, and that's where you see all of the community benefit expense categories that you would find in the Form 990 Schedule H. And that represented about $139 million of our community benefit expense, or 60% of our overall expense. And then uncompensated care is the other segment there, and that's at $93.5 million, or 40% of our community benefit expenses. For the last few years, we've seen about 34% of our community benefit expenses, 34% or so of our operating expenses connect to community benefit expenses. So we wanted to start the presentation with a few highlights in our work in community engagement. So we have a goal at Children's to really enhance children's presence in the community with a focus on improving child health. And we do that in two sections. For team members, we have activities like our Be Involved employee volunteer program, where last year we reported 3,800 hours of volunteer time in the community, which includes time that our team spends at camps, time that our team spends doing activities that they care about, that any sort of volunteer work that's related to children and families. We schedule what are called community learning tours. So we actually take our team out into community to explore different organizations that provide SDOH response resources and needs. We went to the diaper bank last year, learned all about what the diaper bank does, and then we did a volunteer project there where we packed diapers. We did another community learning tour at the Stevens Center at the end of December, where we helped with their holiday gift distribution and took a tour of the Stevens Center to learn about the resources that they offer and how their work connects back to the work that we do at Children's. We also support our team members on boards and committees throughout the state, really, but especially in the Omaha metro area. And we bring teams in to collaborate on projects like we have action teams who work with our implementation strategy plan. We support our employee resource groups with community activities, volunteer ideas, and resources. In community, we're really working hard to deepen some of our organizational collaborations, and I'll share a few of those with you here. We are, for the first time, a part of the Regional Health Council. So we participated at first in 2025. So we helped with the current development of the current CHIP. And then our team distributes what we call program contributions, which are general operating funding for community organizations in town, as well as community impact grants, which we provide for specific programs. One of the projects we wanted to highlight here today is the Vision Mobile. And the Vision Mobile has been operating at Children's since 2018. We're celebrating 10,000 vision exams this year. It travels to various Omaha metro schools and surrounding communities. We do vision screening, and then we schedule time with school nurses to come out and do vision exams for kids who identify as needing an exam after they go through the screening process. And then we're also able to provide glasses for them for free if they need them. So since 2018, we've been able to provide more than 6,300 children free glasses through the program. Also wanted to recognize the the loss of Mike Yanni, the passing of Mike Yanni this weekend. He was one of the key figures, the key advocates for the Vision Mobile, getting the Vision Mobile up and brought to life. So you can actually see this is a photo of the Vision Mobile, and his name is on the side of it because of the work that he did to drive the Vision Mobile to bring it to life at Children's. So very grateful for him. The next project we want to highlight is the Creighton Child Safety Center. And this is a project that just opened in November 2025. It's a partnership between Children's Nebraska and the Creighton Institute for Population Health. The Safety Center is a place-based approach to injury prevention designed to bring resources, staffing, support, supplies to the community where families, to the North Omaha community where families live, learn, and play. We have two priorities for year one, and that is to expand access to injury prevention education and equipment, and then to provide life-saving training to parents, caregivers, and youth through collaboration with community. They're focusing on three priority areas currently: safe sleep, safe home, and safe travel. So safe sleep, meaning back is best, sleep sacks, education around why it's important for babies to sleep in their own cribs. Safe home, things like smoke detectors and fall prevention, and providing resources like outlet covers and things like that. And then safe travel, so all kinds of child passenger safety, car seats, and then education around the various types of car seats, how long a child should be in the car, are some of those initial focus areas. Our next slide actually focuses on the implementation strategy plan, and I'm going to invite Holly Dingman to come up and continue our presentation.
Thanks, Jen. Good morning, everyone. Holly Dingman, Director of Community Health and Advocacy for Children's Nebraska. The last time that we were here, we had presented our 2024 Community Health Needs Assessment data and then gave a report that we were developing the plan. This is our 3-year plan that we publish as a result of the Community Health Needs Assessment, and we finalized that plan and utilized a data-informed process to develop that plan to cover 3 impact areas. Our 3 impact areas are increasing access to care, addressing social drivers of health, and impacting pediatric mental health and wellness. So last winter and into spring, we convened, as Jen mentioned, a cross-departmental action plan, ISP action plan team of 40 members representing more than 20 departments to set the goals, assess our capacity, and decide together what the impact over the years will be. We shared that draft ISP in a poster gallery format at Children's at an event last March. We also offered that digitally for feedback, shared it with the Regional Health Council and some external partners. And our ISP was reviewed and adopted by the board in May and can be accessed on the QR code. I encourage you to open it sometime later this week or today and read our ISP. You can see that there are 5 goals that cross those 3 impact areas. The first goal is around access, so enhancing access to health care by removing barriers to families to obtain and find those health services. Goals 2 and 3 are aligned with our social drivers of health to develop programs and initiatives, really leveraging innovative partnerships. And goal 3, increasing access to those resources through both partnerships and technology, connecting to community-based organizations. Goals 4 and 5 address our pediatric mental health and wellness to expand access to the full continuum of pediatric healthcare for children and youth, and then fostering a healthcare environment that integrates and is really founded in trauma-informed care practices. I have 3 examples of our ISP in action that I'd like to lift up. So a highlight of work for goal 1, which is increasing access to care. is through the launch of our virtual school health program. Children's is making it easier for children and families to get medical care through secure video visits using really cool high-def technology that we can see into the ears, listen to bowel sounds and heart sounds, magnify skin. So from stomach aches to minor injuries to behavioral health screenings, children can be evaluated at school. Parents can join that visit virtually from either work or home, and we can see that child, get them, prevent delays in care, and facilitate the return to the classroom. Our virtual school health program connects students to trusted pediatric nurse practitioners for diagnosis, treatment, and follow-up without leaving the school. Virtual school health is not a medical home, so it's really important to us to coordinate with those primary care providers for follow-up and to share visit information. This has been our pilot year. We launched in August, and we are currently serving 3 rural Nebraska school districts. Most of the visits are coming in for skin conditions and respiratory illnesses. We've recently added point of care testing, so students can be tested for strep, influenza A and B, and COVID. Currently, we are recruiting for next school year, and we are talking to urban and rural districts, both public and private, and we're excited to see this program grow. Goal 2 of our ISP highlight is through our innovative partnership with Healthy Housing to improve housing conditions for asthma patients. So we've partnered with Healthy Housing for many years, but this past year we worked intentionally to improve our collaborations around family referrals and enrollment into the program. Together we were able to assist 76 families to get their homes assessed, and we're talking a very comprehensive assessment. It's a 200-point housing assessment that Healthy Housing Omaha completes. And then they provide the families with a lot of education. Along with the education comes recommendations for home improvements. The home remediations that were conducted averaged about 5,000 per house, consisted of large and small projects from window replacement, removing mold, radon systems, pest control, and again, providing lots of education. When parents and caregivers were asked about the impact that this program had on their child's health, they reported less asthma attacks, less visits to the ER, and decreased hospitalization. So in 2026, we will continue our partnership with Healthy Housing, which is now a program of Lutheran Family Services. So this program they're offering statewide, and we're excited about increasing that access. Our final highlight is around the Behavioral Health and Wellness Center, encompassing goals 4 and 5 of our ISP. We're excited that the Behavioral Health and Wellness Center has opened on January 7th. In early planning stages, we recognized that stakeholder engagement was key to the center's success. So as we prepared to open, we reached out to partners across multiple sectors and began discussions around referral patterns, care gaps, and service coordination. To support that work, we offered tours all throughout December. Were any of you able to attend one of those tours? Very nice. We welcomed 1,600 community members through those tours, representing 90 different organizations across 10 sectors. And I have to recognize Jeannie for her efforts to really lead that effort to welcome those 1,600 community members in. And that outreach continues today. So you are probably wondering what the first month of the Behavioral Health and Wellness Center has been looking like. Well, we've been busy, very busy, and busier than we expected, which is really telling telling the story of need. We've seen 364 patients through our Crisis Assessment Center. 120 of those patients were cared for in our behavioral health inpatient unit. 200% higher than we anticipated this early after opening. We are seeing kiddos come from many communities around. So 112 different communities in Nebraska and Iowa have received services already at the center. I want to point out this photo here. It includes the 162 team members that are making the Behavioral Health and Wellness Center a success. That's the heart. You're looking at the heart. These team members were trained and onboarded in October with extensive trauma-informed care training embedded. To select this group, we had received 700 applications from 22 states. And we hired 186. So in addition to these 162, we hired additional team members and supports, ancillary services that these Behavioral Health and Wellness Center team members needed for support. I'd like to tell a patient story that I think really illustrates both the need and the impact that we're making in the community. So a teen arrived at our Crisis Assessment Center feeling really overwhelmed and not knowing where to turn. As he worked with our care team, he shared for the first time, "I don't feel alone." And he described the support and he described the support that he was receiving that he hadn't felt in a long time. During the visit, he opened up that his girlfriend also suffered from depression and didn't know where to turn for help. So with encouragement from the team, he asked if he could reach out to his girlfriend to reassure her that the center was a safe place, that where he felt cared for, and she could too. A few hours later, she walked in through the doors of the Behavioral Health and Wellness Center, was then admitted through the Crisis Assessment Center, and received the care that she needed. I think it's a great example that by meeting one young person in crisis with compassion and hope, we're able to reach another who may have otherwise not been seen. The Behavioral Health and Wellness Center, I think, also represents what is possible when healthcare organizations, philanthropy, government, community all align around a shared mission. Thank you for this opportunity. We will take questions. I do want to point out our implementation strategy plan is here. Our community impact report is almost hot off the press, but this is not ready for circulation, but you will get this soon. So we'll make sure we share that. Want to join me?
Thanks, Mr. Chairman. Thanks for that report. We, of course, as a board, get these updates from all systems, but yours is always interesting to hear because it is focused on children's, of course, and I appreciate hearing about your partnerships with our schools and all that you're doing to help our younger folks in the community. Of particular interest to me is that Behavioral Health and Wellness Center. So I want to congratulate you on opening that, and I was going to ask you about your first experience there for the first month and a half, which I think you covered pretty well, but I think it shows exactly what we thought and knew, that the demand for those services is great in the community. Is there anything that surprises you in that first month and a half, or any challenges you're experiencing that you'd like us to know about? Sure.
So thank you again for your time.
Can
My
I
name is
add a
Megan.
thought on that while you ask, can I add a thought on his question?
I'm sorry.
I want to add a thought on
Yeah.
his question because when I went through it, the question I asked is did you say you're 200% over what you thought you had? Did I hear that right?
For inpatient.
Okay,
Yes.
but I just want to add on the councilman's questions to say, because the question I asked was it big enough? And I'm wondering now, after your first month, do you still think it's big enough? And I was assured that, you went through the studies, you went through everything, but you 200% over. I'm wondering, are we underbuilt already?
Okay, thank you for your questions both. So I'm Megan Connolly. I'm the Vice President of Ambulatory Services and Community Outreach. And so with our Behavioral Health Center, and Holly presented our numbers. And so to answer your questions, Mr. Rogers, yes, we were surprised by the amount that came in at that point. We are ready to take more patients. She talked about the team that we hired in our, what we're calling our phase one. So our phase one, we hired over 170 employees to support we have 24 inpatient beds open right now. Those filled up by day 4, those filled up, those inpatient beds. Our crisis assessment center and the urgent care continued to have flow. So what we are seeing is that we have ramped up how fast we're going into phase 2. We expected to enter phase 2 probably around May-ish. We've already started now. So we are going to plan on opening our full 40 beds as soon as we have our additional team members hired and trained. Training is such an important part because it is something that takes a very specific skill set to take care of these kids. So once the phase 2 team members get trained, we'll be able to open our full capacity. So we'll be able to better judge at that point how things are going. So when Holly said that we were at that point of capacity, that was for our phase 1 and what we're seeing. Does that help? And I'm not sure if I answered your question, Mr. Foster.
Yeah, I think that helps with the context there. And then any other thing you're finding that's been a challenge to you you'd like us to know about, or?
Yes. So one of the things that I think that we were surprised and pretty sad about is that we expected a wide range of aged patients come in. We were seeing that a lot more of the younger kids came in than we expected. So we're still seeing adolescents in the higher age range, but to be honest, we are seeing a lot more school age and young kids come in. And that did surprise us. So we pivoted quickly and we increased our capacity to take care of those kids because they require different size clothing and everything else. So we were able to pivot and take care of them, but that is something that did surprise us.
Interesting. And I know a big concern too was workforce that you started to touch upon there, in particular psychiatrists and providers. How's that going so far?
We're very lucky. We continue to have a strong pipeline of people who would like to work with us. Part of it, I think, is the delivery of care model that we've instituted at Children's Nebraska. We have brought in people. We are very lucky to have our Senior Vice President of Behavioral Health, and she came in with a very trauma-informed care approach. So I know several of you were able to tour the center, and you were able to see that throughout as you toured the actual facility. The care model that is being delivered is very unique. And so I think as that word spreads, we are getting, how many states did you say that?
22.
22 states. People from all over the country are hearing about that, and I'm knocking on wood, we are continuing to get a high qualified applicant pool come in.
And are you finding it's primarily private insurance, Medicaid? What are your patients experiencing when they come to see you?
I brought numbers just in case. So I have my notes because what we are finding, and this is January, so we have a month worth of data, 63% of our crisis assessment patients are covered by Medicaid. So we are at 63%, where children's overall, we're about 50%. So looking at our behavioral health, the crisis assessment center is 63%. The inpatient, the kids who are admitted, they're at 54% Medicaid. The rest are by private insurers.
Mm-hmm. A good example of why Medicaid is important.
Yeah, very, very important.
Yeah, thanks for what you're doing.
Could you tell me about the legal age in terms of a individual walking in when they need parental permission and when they don't?
Oh, I don't know if I can be as eloquent on the actual regulations. I know that anyone can walk in. When we need consent, I can get back to you and let you know if if a minor walks in, if a 16-year-old walks in and requests behavioral health, I'll have to find out what our process is for consent.
So let me ask you, I'm just curious from your statement, the last statement you made to Councilman about the kids coming in and the range that you expected. Have you all seen the report done by OBNY that was commissioned by Senator Wayne? What's your thoughts on that and how this plays out for your for that realm?
Yeah, I
Well, let me set the tone for this.
uh
Assuming everybody doesn't know about that report. I think he took $500,000 of ARPA money and had someone come do a study, and he did the study in 6811011, probably 104, about the traumatic effects of being there and violence. So that's the tone for it. Did you give them that? Okay, okay, all right, okay.
yes, I did share that.
I'm just curious on your thoughts on how this plays out, and particularly the kids' ages that you saw and how this plays out for this son.
I can just speak for kind of community, and I think it calls us to really lean in to trauma-informed practices, not just at the center, but embracing trauma-informed practices at school and in collaborative spaces. Really working with those community providers. The Behavioral Health and Wellness Center will see a lot of kids, but we can't see everyone. So it's, again, coordinating with the providers and having that trauma-informed practice really embraced across all systems. But that's a very significant report that points to really high need. Yeah.
So I just want to make sure when you all use the term full continuum for goal 4, do you mean the wellness center is the kind of completion of the continuum, or does that give you full breadth of? I'm trying to see what you all's definition of full continuum is when you say that.
When we look at how we set our Behavioral Health and Wellness Center up, we have a primary care pediatric office in the side of that. And so we see mental health as health. So
Okay.
we want to make sure that we're integrating primary care and making it as normal as ever to get mental health. So we have our primary care office, then we have our crisis assessment center, which really is made up of 2 things. For those of you who haven't toured it, first is an urgent care. And we've said a few times, people can just walk in. They walk in and they just need care. And so we have an urgent care, it's basically a hallway where they get full assessment, and at that point, a decision is made and by a qualified therapist or someone licensed to deliver mental health care. They will do an assessment, get immediate intervention, and a decision will be made. Does that child, is that child safe to go home? Or do we need to help that child for a little bit more? So then they can go into what's called our crisis stabilization unit. In that unit, we can keep our kids for up to 24 hours. And so they get further intervention, further assessment, and in that setting with licensed therapists, we decide, is that child okay to go home with a safety plan, or do we need to admit the child for further care? So then they will go up to the inpatient area if needed, or they will go home with a safety plan. So if they go up to inpatient, we treat them for as long as they need, and upon dismissal, we either have them go multiple ways to complete that continuum. They can go to outpatient care, or we have partial hospitalization. And so they can participate in our partial hospitalization program, which we have 31 patients currently, or at the end of January. We have 31 patients in our partial hospitalization unit, and to complete that continuum. When they are able to be then dismissed from that program, then we will hand off either to their primary care provider or to another community therapist if they are not with Children's. So we're very, very cognizant on how important warm handoffs are. And so we will make sure the child from the beginning all the way till they process through and make sure they get the care they need will be complete.
my last, so the virtual school health center that's piloted in rural right now,
Correct.
it could probably go urban too. What's your plans for the urban districts? Because
We
when you're
would
saying
love-
it's doing work with attendance, I'm curious
Right.
on what your plan is with it.
Right. We are open and actively recruiting. So if you have a school district or you know of a school leader that you would like to introduce us to and bridge that conversation, we would love it. We are open for working with urban and rural districts.
I do. I
We
will.
have been
Great.
in talk with Omaha Public School. We've been in talk with schools, and I think that between the principals, the school health team members, they're just looking at what they can help or bring into their school and provide for those students. But we're here, and we'll continue to be here for them.
Will you go through yourself or will you go through the school-based health clinics that they have?
It won't be through the school-based health center unless they would request that, but we know that they are getting very good care in those areas. And so they already have advanced practice providers seeing kids. So those aren't schools that we would go in unless we were asked.
Okay. But I mean, okay. But no more. Okay.
I think just to piggyback off of that question, offering, I mean, it looks like when we look at primary care for children, there's definitely a desert in North and South Omaha. And so looking at schools, particularly OPS, that does not have a school-based health center offering there would be a good place to start. Just because, yeah, there's not a lot east of 72nd, north and south. Awesome presentation. Thank you so much for the information. My other question is on the inpatient side, do you guys have like a hospitalist that rounds on them as well? Or what's the model for their other medical needs? And then are they also lead screened when our patients are coming in too?
Very good questions. So they are not seen for, I'm assuming you're talking in our Behavioral Health and Wellness Center, the inpatients, okay. So our hospitalist service does not round over there, but we have a process in place that if there is a medical need that arises once they are admitted, then we have either our adolescent medicine, our primary care providers, or if needed, we have a safe transport vehicle, and we will, because it's across the parking lot if you haven't seen it. The hospital is, in one place. The Behavioral Health Center is on our property. It's just not connected by a tunnel. So we have a safe vehicle that we will bring them over to the hospital to be seen if they need that level of care. Otherwise, our adolescent medicine providers or primary care providers will see them. And we have had to transfer kids back and forth.
Are you seeing any evidence of the role of social media related to mental health and behavioral health and crisis?
I am not qualified to give you an answer that is not opinion-based. And so I can get more information from either our lead psychiatrist or our senior vice president of behavioral health, who is actually a therapist. I can't give that to you, but I can get it for you. I have an opinion.
Well, I don't have any problem with you giving me your opinion, unless you don't want to.
You qualified it as your opinion. You go and give it. So, yeah.
My opinion is yes, but that is truly just my opinion. I think that the stories that we hear from our teens especially, and even our younger kids, it really hurts the heart to hear some of the stories.
Thank you again for your presentation. It's always wonderful to see all the services and everything that you provide for our community, for our littles especially. Two questions in regards to your virtual school health program. I second with Dr. Jones is that we much need those services in South Omaha and North Omaha and those schools that don't have school-based clinics. But I would like to get more information in regards to parent consent. How does that work? And then also, is there a cost attached to that virtual care visit?
Really good questions. So our consent process has parent consent, a health history, and an authorization to release information. Those are circulated by the school district and gathered from parents before a visit is put into place. But we've got a process where we can receive those forms and then schedule right away. So it is essentially a urgent care kind of turnaround of first come, first serve. The second question.
The cost.
Oh,
if-
the cost,
If someone's
yes.
underinsured or.
Right.
uninsured.
So we contract with the district. We offer a couple of different models for the district to bring virtual school health program. One that is a contracted service, and then one that is an fee for service, so does utilize the student's insurance. There are pros and cons. We've had, in our small pilot, we have schools that have utilized both. So it's kind of a, let's design it for what works for that particular district.
Thank you.
Uh-huh.
One last respectful request. A year from now, when you come back and report, will you be able to identify population according to zip code, please, for Douglas County in terms of where these individuals reside?
For the behavioral health piece?
All of it, yeah.
Oh, for all of it, absolutely.
Okay, let me, you mentioned, I can't remember exactly, but basically in some extent you talked about some of the things you're collecting. What's your feedback loop from the data you're collecting and seeing to where it feeds back up to the policy realm? What's your plan on that? Will it feed back, for instance, does some of this come back to the health department to feed into the community health needs assessment? Are you feeding this back up to the state? Are you feeding the stuff you're gathering? What's the feedback loop to try to see where the canary is in the coal mine?
That is a good question. So if I'm interpreting your question correctly, so we do actually a few things. So I can say with Dr. Hughes, we have quarterly meetings and discuss what we're seeing both in Douglas County and what we're seeing at Children's, and how can we help each other.
Okay.
And so some of the information that we gather, even from what Holly and Jen talked about with our virtual school health or our Healthy Housing Omaha partnership of these kids that have houses that have triggers to cause asthma, and we're seeing ED visits. So that is one thing I can talk to Douglas County about and see how we can help each other. We have an immunization advocacy committee at Children's, and we have a member from the health department who sits on that, because we can't do that by ourselves. We also have Melanie, who is our Director of Government Affairs, and so if we need to advance that to more of a public policy, she is very in tune to everything that is happening. Everything that was outlined today, including the behavioral health piece, she's very much involved with. She understands what we're seeing, what challenges we're having, what barriers are there, and who can we partner with so we can help the kids. Because really, when it comes down to it, that's all we're trying to do is help these kids. Did I answer your question?
Yeah, I mean, it's after 1 month, it's still developing, but I'm just curious if you gave any thought to it. No, I said I didn't expect the answer, but I'm just curious where your thought is after 1 month. But that's good. I see.
Yeah.
At least I know where to think about it next year when you all come. Or I know what questions I ask if you all are meeting quarterly. Okay. You got a question?
Can I ask?
Go for it.
I have a bunch of questions, but I'm going to leave several of them for when we meet next month, if that's okay, Megan. One question I have around healthy housing: have you provided any assistance with lead mitigation or remediation, so windows, paint, that sort of thing, in the home? And the reason that I'm asking that is because I don't know how public this is, so I hope I don't get in trouble, but I know that the city was not reawarded the HUD grant that they have had for many years, that they've typically used for that kind of work. So typically when we have a kiddo who tests, high for lead and they're undergoing treatment and we go out and we do an assessment in the home, certain individuals may qualify for this assistance through the city. And unfortunately, after 2026, that assistance, it sounds like, may not be there anymore. So I didn't know if you were currently doing anything in Healthy Homes around that, or if that is something that would be of interest in the future.
Go ahead.
So as we discussed, we partner with Healthy Housing Omaha, which is now part of Lutheran Family Services. One of the assessments that Healthy Housing Omaha has always done has been lead and lead mitigation. They do education, they do anything they can to mitigate what they're finding. Lutheran Family Services, when they took over that organization, they kept that commitment. And so from a funding perspective, I am not able to speak on how that is going to happen, but their commitment is continuing to be strong, not only in the asthma part, the air part, but also how they're approaching lead and other environmental hazards.
Great. One other question that I had is, what are you projecting or predicting that you might see in terms of uncompensated care costs with changes to Medicaid? Are you expecting a lot? Are you expecting things to be business as normal? What are you thinking you might see?
We are watching that very closely, and we are working with our policymakers to make sure they understand what decisions that are being made right now because of not what only was passed with HR 1, with what's going on with Medicaid, but also what our own state has proposed. So we're just working to make sure they're educated and they understand what their decisions will, how they will impact babies and children. That's really what our voice is representing, are the babies and children. And so we are trying to navigate what that will look like no matter what decision is made. It will impact us, it will impact kids.
I figured. It's always nice to hear it out loud from the experts, though.
Can I make a note for you? And I don't know if you all go that far back from the presentation. I do know from when we were doing them, the question I asked Methodists when they came last month was, so you had 2018, they passed the amendment to do Medicaid expansion. Then we had the growth, you had COVID, and then things got adjusted. Now you're back there. Can you all make a note of what is the, I'm trying to measure what gains we will lose by the passage of HR 1 compared to, I'm trying to see if these numbers look like they did in 2017 before we passed Medicaid expansion and what that loss is. If you all can keep track of that, I appreciate that. I've asked Methodists to do that too, because my thought is it's going to make itself up in uncompensated, your uncompensated care piece, and I'm trying to see how much that hit is to make the case.
We will be able to track that very
Thank you.
closely.
I think we're good. Thank you. Let me say, you all's presentation is always not entertaining. It's informative. I don't know sometimes if it's scary, but it's always good. Appreciate it. And I appreciate your attention to it.
Thank you for your time.
Thank you.
It's always fun to present, so thank you for your time, everybody.
With that, we will roll into item B and the Environmental Health Division report. And I appreciate you all for your patience having to be carried over from last month.
No problem.
Hang on. There we go.
Good morning. I'm Eric Bradley, Division Chief of Environmental Health. I'm just here to give you a quick overview of some of our accomplishments from 2025, and then also some goals we have moving forward. So our EH division is broken into 4 sections: air quality, sanitation control and sanitary engineering, food safety and compliance, and lead poisoning prevention. First I'm going to talk about is air quality. This picture here is what we call our in-core site. This is our main air quality site. Pretty much every single monitor we have throughout the city, we have one here at our main site. So the programs we have, you see here the map of our locations. At the very top is Blair, then you have Ralston and Bellevue at the bottom. Those are both PM 2.5 monitors. The red is North Omaha, where we have, see, that's ozone and SO2. The pink is Creighton, and that's a PM 10 monitor. The yellow is off Dodge Street, and that is a carbon monoxide monitor. Then the green is our in-core site, which I showed you before, which has all of these different monitors. Then our staff also does response to indoor air quality and mold complaints. So some things we did this past year, we were able to purchase an ozone primary standard through our EPA state funding. Because that funding has basically been flat the last decade or more, we went out and got a grant of $42,000 from Sherwood Foundation and purchased another ozone primary standard and a trace level carbon monoxide analyzer to replace some of the ones. Typically our staff have to take old ones, get pieces out of that, and put in the newer ones to kind of keep them working. So we were able to purchase some of that. We did have air quality exceedances this year for the PM 2.5 and one for the 8-hour ozone, and that was due to the Canadian wildfires. For this year, because Omaha Metro did pass 1 million people last year, we are now required by federal law to an additional monitoring site, which will be somewhere along I-80. We're currently working with the state to figure out the exact location, funding, and exactly what type of equipment we're going to need there. We're also working with, or in discussion with North Omaha Power Plant. Y'all have heard about that, what's been going up there. For maybe they will purchase 1 or 2 PM 2.5 monitors and provide us funding to kind of maintain that and track the data as we move forward with the power plant. And we also want to meet with MAPA to discuss some possible collaborations. In the past, they would give us some funding. We'd go out to schools and educate the students on air quality. So we want to approach that and then also see what other opportunities we can get through MAPA. Then sanitation control and sanitary engineering, you can see by this picture, this staff handles quite a bit. We inspect and permit commercial swimming pools, permit residential swimming pools, inspect and permit drinking and geothermal wells, permit and inspect septic systems, conduct environmental assessments when the requests come in, respond to nuisance and pest control complaints, handle domestic animals, which is basically bees and backyard chickens, and then we also do mosquito and tick surveillance. So some of our accomplishments this past year, we had no drownings or near drownings in any of our pools, whether commercial or residential. Conducted almost 700 pool inspections for commercial ones and reviewed over 300 plans for residential pool construction. Addressed 660 complaints and conducted almost 170 environmental assessments. We also inspected 28 wells and 93 septic systems that were installed throughout the county. Our revised residential pool and livestock ordinances were approved. We only had 1 positive West Nile virus mosquito pool this year, which was very good. We were actually able to finalize our registration of our drone with the FAA. And we actually offer mosquito wipes containing DEET in our vending machines, which is very popular. We actually sold out probably with about 2 months left, or didn't sell out, but we ran out with about 2 months left in the mosquito season. Things we want to do this year, we're currently working with Douglas County Environmental Services to update the county's residential pool ordinance to match the one that the city just passed. We're also looking at updating our commercial pool, septic system, and nuisance ordinances. I say possibly on nuisance because we do part of that and the city does another part, so we want to reach out to them to try to figure out if this is a good time for them to review it all at once. The septic system one is we've already kind of reviewed. It's part of the plumbing code. So the plumbing inspector is basically doing a draft ordinance right now. As soon as we get that final draft, we'll bring it to the Board of Health for approval before it goes through the rest of the city's process. There was only 4 or 5 little minor changes for us on the septic one. Commercial pool inspections will switch from paper to electronic. Our county GIS has been working with the state for us to get access to use their database. The way we've been doing it, we write the inspection up on paper, come back, scan it, email it to the state, and the state enters it into the database. Now we'll be able to do it all from the field. Working with the city plumber and the Douglas County Environmental Services on some issues we've been having with some of our pools, residential pools. Time we get the pool permit, they've already got the pool being built. They've already got the plumbing permit, so we're trying to work with him to figure out, all right, you can't get a plumbing permit until you have your residential pool permit. Same thing with our septic, which he even says sometimes he'll get a plumbing permit for a house or for a system, and the house is already being built. So there's still some issues where people are getting through without following the pattern for the process. So we're working with that. We're also going to be working with .com and Grant Street to do some online payments for all the permits for this section. And then we hope to launch our drone. We've been working on that for a while. FAA treats a drone pilot just like an airplane pilot. As for me, I'm on a very small amount of blood pressure pill. I cannot be a drone pilot because of that. So we've had some issues with the two people we had pass the pilot drone originally. We had a new person who just started. She's passed it. We have one of the other pilots who's about to go back to get his medical clearance. And hopefully this spring we'll be able to do an actual launch and then use it to do some larviciding this year on the mosquito program. Basically, you have to be like an airline pilot just to fly a drone. So any medication that might impair you from flying a plane, they don't want you flying a drone either, which we did not know that originally. So food safety and compliance, that's your brick and mortar, basically your restaurants, grocery stores, convenience stores. We also do child care facilities and schools, mobile food trucks, a bunch of temporary events, farmers markets, the new food handler training, Cultivate, which is our education and outreach program. Also investigate foodborne illnesses, complaints, handle cottage food, and address illegal vendors. So last year we conducted over 6,200 inspections. 4,200 of those were routine. Conducted 157 follow-ups, 346 mobile license inspections. This is when they come to get their initial permit for the year. Over 1,500 other inspections were temporary events, farmers market, child care, and the summer feeding program, and investigated over 370 complaints. Cultivate, we consulted with 59 different food establishments and responded to 41 interpretation requests. Oops. What should I do? The state also adopted the 22 FDA food code, which we adopted in our food ordinance, which is also approved. We worked with UNL, .com, Grant Street, and our own finance department to get the food handler training developed. Our Inspect2Go company we hired to do our inspection software, they completed the development of that. We had a $16,000 retail flexible funding model grant from the National Environmental Health Association to work on meeting the 9 FDA voluntary retail food standards. And we began using some software that the city has to ensure efficient and more timely certificate of occupancy inspections. Before, it was all being done by email communication saying, hey, we're doing a certificate of occupancy, we need you to do it. Now we have that access to that software, so we do it, we can enter it right there in the field, and the city knows that we've approved it. So just some more efficiencies we've been working on this past year.
Eric?
Yes.
What's Grant Street?
That is basically what the county uses for the online payments. They're the ones that do the credit card payments, so they just work with .com very closely for that part. So for this coming year, our new inspection software has already gone live. We started that first of the year. The online applications part will roll out later this year. Our new grading system is also live with online posting to roll out in a few months. The Inspect2Go is working with our GIS department to get that all figured out. So we're still a little ways away from that. But after 6 weeks of running this system, we have not had any managers or owners call us with any kind of questions on the grading system. Our staff have been explaining it while we're out there, the difference where it went from, excellent, that rating to ABC, that one now. The online food handler training in English and Spanish went live January 20th. As of this morning, we have just 1,603 people have signed up for the training, and 1,271 have completed at least one level of the training. So it's moving forward. We're not quite where we need to be because estimated we have about 40,000 food handlers. We're not marking this or the Certified Food Protection Manager as a violation until July 1st. We're just continuing to do educational outreach now We were doing it last year too, but we're still letting people know, hey, you need to have your staff go through these trainings. Working with, like I said, working with the food establishments on compliance. We need to relaunch Cultivate. We had one of our regulatory inspectors leave last fall, and our Cultivate inspector moved over into that position. So we hired his replacement late, basically at the end of the year. That staff person is now going through all the food training. They're already doing some of the interpretation, but we haven't really got Cultivate up and going. Hopefully in the next few months, we'll get that back up and running and make a good push to go out there and make that a little more well-known. Right now, we're just focusing on the restaurants we're having issues with to kind of help bring them into compliance. Then our legal vendor task force, which right now is basically just internal staff talking, kind of keeping a track of who we've seen, where we've seen them, and kind of moving forward that way. Lead poisoning prevention. Several programs, interior lead dust, which is basically if they've had any soil remediation done by the city, we'll come in and do dust wipes to see if there's any, the house has been cleaned properly. Environmental lead risk assessments, that's when we have a child with an elevated blood level. If you live in a home that's pre-1978 and have a child that's under 7 years old there, we will come in and do an inspection at no cost. Then we're also, any kind of mitigation that's been done, we'll come in and do a clearance inspection for owner-occupied dwellings. Then we provide test kits for lead water testing in schools and child care facilities. So this past year, we screened over 16,000 children for blood. That was a over 14% increase from 2024. Our goal was 5%, so we almost tripled that. Our number of EBL cases was down 11% from 2024, although we did have 3 that required chelation. Reached over 14,000 people at 187 different local events. Conducted 333 actual lead inspections. Conducted 101 interior home visits to provide HEPA vacuums. Received a $30,000 capital grant from the Sherwood Foundation to purchase a lead analyzer that not only does paint, but also does spices. So we can test the spices. It'll give us a yes or no if it has lead, and if it's yes, then we ship it to a lab to have it actually determine what the level is. Provided 12 lead care analyzers to 5 clinics in the Superfund site. That's the one where they can do a capillary test, and within 2 minutes, they can determine if there's an elevated blood level. GIS created an internal map which shows our location of our inspections for our staff, so we can click on that location, has all the history of that property, and we can go in and update everything that we're doing, so everything's in one place instead of going to just the old filing system. And then we conducted 14 presentations at local events. For 2026, we want to increase blood load screenings by 5% again. We're currently reaching out to community partners. We have a survey asking several questions about a draft lead ordinance. Currently, our only lead that is actually mentioned is in the nuisance ordinance, and it's just one blurb. So we want to kind of create an ordinance. We've got a QR code when we go out and do EBL inspections or any other inspections or outreach. We have this survey available. We've already have, as of this morning, we have 36 responses, and it's been out there about 2 weeks. So we're going to try to pull this all together. As we have a draft ordinance, we want to add this to it. We'll probably speak with several of you and several of the city council before we actually bring it forward. We just want to get all our ducks in a row before we do that. But hopefully later this fall, we'll have it before the Board of Health for approval. We also want to take the consumer products and spice testing results and publish them on our website. We have some old stuff, and then with some new stuff we're doing. Right now we're working with GIS to get basically the same categories all there so we can put it on there. So if we go out to a home, we test one. If it's the same lot number, we won't retest it. But if it's a brand with a different lot number, we'll test it and we'll put it on there, whether it's good, safe, or what the lead level is. Our advertising campaign will begin in the spring and summer, like always. And we're also looking at purchasing lead analyzers instead of leasing them. Well, we were waiting on EPA final approval, but we may reach out to Sherwood when their capital grant opens up. Currently, what we pay for a 9-month lease on a lead analyzer is what it costs to purchase one. So we're looking at replacing the three we have and releasing and just purchase them. And then telling our story, last year we did several presentations across Nebraska, North Dakota, NACCHO's annual conference. And this year we have even more scheduled. We have one abstract that will be on the Nebraska Public Health Conference coming up in March. We submitted abstracts to the National Lead and Healthy Homes Conference, the Council of State and the Territorial Epidemiologist Conference, one to NACCHO. We submitted 6 abstracts to NEHA, which is going to be in Kansas City this year. 3 were accepted and 3 were placed on a wait list. Based on the issues we're having with the federal level and having them get an approval to travel, with those other 3 that are waitlisted will probably be on the agenda as well. Then we'll also be submitting abstracts for the Nebraska Environmental Health Summit, which will be coming up this October. Any questions?
Did I see an article in the World Herald about restaurants 2 or 3 days ago in terms of not being in compliance?
Yes, we put out our list usually in February. We've done 2 lists because the first list didn't get it down far enough. We were about 190, I think, originally, and now I think we're down to about 100. We are going to start, hopefully, we had some issues with the payment process. What they were giving us is about 2 days behind, I think. So we were kind of still seeing what comes in, but we're going to start calling the remainders and remind them, hey, you need to get in here and get it paid. Then once we get the list down far enough, we'll go out and start doing closures. As I was talking with Mr. Wade earlier, once that starts, word spreads, and then everybody else usually comes in and pays. In the past, the media actually reached out to us and wanted that list. Last year and this year, they didn't ask. We actually had to do a press release. And I think Omaha Scanner picked it up first, and then the Herald picked it up after that. And I think one of the stations picked it up on one point, but hasn't really got the big press push as we wanted. What's that? Yeah. Well, the same with our food handler. When that launched, we put out a press release, and it didn't really get picked up by the media either, which is probably one of the reasons we're a little low on what we'd like to be with the trainings. I think it's still early discussions, trying to figure out. We did reach out. They do seem interested in working with us to do that, because right now the closest one we have is Creighton does PM10. That's fairly south. The one in North Omaha just does ozone and SO2. Really need a PM2.5 monitor up there to figure out what's going on. We've also brought up the point, if we don't get PM2.5 monitors, we might reach out to some partners and some of the nonprofits there in North Omaha to get some purple air monitors. They're not regulatory level, but if you get enough of them spread out, they can tell you when something's happening, and then we can investigate a little bit more.
So is there any kind of legal pressure on the North Omaha Power Plant to provide a monitor for their, I suppose not, because of all the stripping of the EPA?
Oh, I know in the original agreement, when they were working toward this, they were supposed to purchase purple air monitors for some of the groups around there. I think the only 1 or 2 that were there were actually purchased by some of the community groups in the area. So I don't know if there's so much pressure, but they do seem to be open to working with us on doing something.
I think from the conversation I had with a board member, based on the last action, there is some conversations that's happening, and so we just need to see how they develop with that, because from the letter Dr. Hughes wrote, she gave some options. I don't know how far they are in there, but I know somebody's thinking about it.
Yeah, I can tell you, I've had a couple meetings with Craig Moody and some others from the board there, and there does seem to be interest in purchasing those, at least one continuous, which would be situated where our other monitors are. It would be kind of in that same configuration, which would give us, I guess, more official PM2.5 monitoring, since we don't have that up there right now. To my knowledge, there's not legal pressure per se. It certainly was in their previous plan when it was extended the last time to purchase some kind of monitoring equipment. I am not privy to that. I don't know what conversations might have happened internally about that. It didn't happen, and so now we are looking at hopefully being able to do that, and also perhaps get a little bit of funding as well for monitoring, because currently our staffing is at capacity. So we would need a little bit of extra manpower in order to adequately make sure that we're keeping an eye on that. There are some other things that we're talking about, which I can update you on during my update if you'd like, but yeah.
One final question. What would the cost of a monitor be for Omaha Power Plant to put the kind of monitor you would like to see?
It's not that much.
That, I'm not, Russ, are you on the call by any chance? He might know better, but
I might
think-
be able to find it.
yeah, I think it's probably 40.
Yeah. Can you hear me?
Yep.
I think our proposal to OPPD was around a couple $100,000. That was for one PM 2.5 continuous monitor, which usually cost around 30 to 40,000, and then 2 or 3 purple airs on the other side of OPPD, plus staff to run it for a couple years.
Thanks, Russ.
Thanks, Russ.
And then just one follow-up on that too. A PM 2.5, what does that do as opposed to a purple monitor?
The PM 2.5 is just more specific. It's more of a regulatory level. They monitor the same thing, the PM 2.5, but the purple air is just more citizen science. If you have enough of them, you can't take legal action based if there's an increase on something, but it tells you something did happen in this area at that time, and you can investigate more on it. There are several areas around the country that have these purple air monitor groups that were fighting with the city or some businesses that now that they've got these units set up, even the ones nothing happened, what they used to say, now they come, oh yeah, we had a release of this or something. So it has brought the community more together where they're in discussions and not just kind of pushing off the.
And the
They're-
PM 2.5 is the small particulates. So those are what we typically would worry about with emissions from burning coal.
Yeah, okay. Well, it seems to me that'd be a good idea. So that's something I'd support. And then thank you for your updates on the ordinances too. I think the communication between city and county has improved, it seems to me, over the last couple of years even. And we've seen some good results with the food and restaurant ordinance and livestock and pool updates. And now we look forward to hearing more about the plumbing and lead concepts too. Thanks.
And then we do have a update from our finance here. We're down to 40 unpaid now. This could be less once we get the update from the treasurer for today. So we do have it down to get it where it's more manageable.
Appreciate it.
Thank you.
Good morning. I have a whole list of updates for you today. I am going to start with just kind of hitting some highlights from some of the reports that you already have in front of you that I kind of wanted to bring further to your attention. First of all, I wanted to just talk about Credible Mind, which is our platform that we launched to really give people in Douglas County additional mental health resources. And we did see an 8% increase in January with the use of that, so 643 users. The most popular topic continues to be around anxiety, although we did see also a number of people who interacted with information around cognitive behavioral therapy. So hopefully that indicates that that is an interest that perhaps people are starting to explore, and if they need more assistance, they're hopefully finding the resources that they need to help that happen. About 18.5% of our users in January also utilized the user resources page. So hopefully people are looking for and finding the resources that they need for their mental health here in Douglas County. I also just wanted to put out there that I agree that the relationship with the city has certainly improved in the last couple of years. In fact, at my last monthly one-on-one meeting with the mayor, we recorded a TikTok to promote Credible Mind. So that should be posting to TikTok sometime soon. And so that was a lot of fun, and I think is a great way to really show that there's just broad support for people taking care of their mental health and this resource that's out there. We're getting 2 more vending machines. Those have been so popular, and the great news is we're getting those 2 vending machines at the same cost that we're already paying for the 5 we have out there, so no increase in that contract. And so those machines hopefully will be coming in the next month or so, and we're currently looking for the right places for those vending machines to sit. So we're really looking forward to that, and I have to just shout out to Leah Casanave for all of her innovative work on that and getting resources out, and really to the rest of the department for having some great ideas for things to put in those machines. We, of course, have condoms, we have naloxone, we have wound kits, we have things like that, but we're also adding, like last summer, we had the mosquito wipes. We're talking about having sunscreen available potentially for the summertime, and also making some cold weather gear potentially accessible for those who might be out in the elements and need that. So we'll see what happens. It seems to just kind of grow and become this wonderful thing, and I know it has also spurred interest in other jurisdictions. So great work on that, Dr. Casanave, and also the work with NACHO, who is promoting kind of Credible Mind, and the vending machines. These are all Leah things that she's been doing. So good job. Fantastic. I love seeing just the increase in ability to reach our community. I did want to throw out a celebration note. One of our air quality specialists, Neil Nagowski, was able to earn his REHS certification in January, which is a big deal. We give our environmental health specialists 2 years from the time they start employment with us to earn that certification. It is not a requirement at the state level anymore, but it is something that we continue to require for our environmental health specialist position, so we're really proud of him for getting there. Yes, we talked about the permit fee non-payment list coming out. This is a mid-February thing every single year. It is not my favorite part of the year, as you know, typically it does cause a little bit of consternation out there in the community, but ultimately we get there, and we will continue to work with our restaurants and other associations out there to get their permits taken care of. So it was good to hear that we're down to around 40 or maybe even less. That's fantastic. Speaking back to the lead conversation that we had a little bit with Children's, there does seem to be some community interest in reestablishing the Omaha Lead Coalition, which I think was in existence pre-COVID. I was not here when that coalition existed, and it was, I think, pretty specific to perhaps neighborhoods in North Omaha and or the Superfund site. It was, I think, a pretty popular group, and it really was a citizen or community oversight and coalition that basically watched what was happening in terms of cleanup and how to help the community around the lead situation in the Superfund site. And so it's exciting to hear that there is maybe some community interest in getting that started again. I believe Brenda Council was the one who headed it before. I know that she was in conversations about this as well, and so I think she probably would be someone who was in leadership in that kind of a coalition again. Again, these are really early conversations, but we are excited to hear that there is more community interest in doing that again. And we also do, I believe, that Eric mentioned this, but I just wanted to promote again that lead poisoning prevention opinion survey is out there in the community. It's going to stay open through, I think, May, and that is really going to help us to better write and flesh out that ordinance that we need to update on the city code. And so certainly keep that in mind. If you can promote it to others, we want to hear from the community so that we can do a good job serving the community with how that ordinance turns out. We are continuing to take calls, educate, and monitor for measles. Luckily, we have not had any measles cases here in the Omaha Metro just yet. Last month, there were 4 cases in the Columbus area. They were all within a single family. There was also a case in Lincoln recently. Again, we have not had any here yet, but we definitely are continuing to have those conversations pretty much daily with providers in the community who have that on their differential or have a suspicion with a rash illness in a kiddo. And so we're continuing to have those conversations. And of course, if we have a case, y'all will be the second to know because we'll be the first to know. But I will make sure that we let you know right away if that does happen. I do feel like the department is well prepared if and when that does happen. We've been actually talking about and preparing for it with our incident management team for over a year now. So I feel like we are in a pretty decent place. If it does happen, when it does happen here, we'll be able to respond pretty quickly to that. I wanted to also let you know that we were able to hire a FEMR nurse. This is really exciting because at times we have had that position stay open for a very long time, upwards of a year or 2. And so we were able to offer that last week, and that individual did accept. I've been assisting FEMR by providing some case abstractions so that we can continue having our FEMR team meetings and keeping that process moving, knowing that that is something that is of utmost importance to our community. We also have a Healthy Horizons prenatal project that is underway right now. That is basically a pilot project, if you will, that several communities are undertaking around group prenatal support. And we are working with UNMC on what that's going to look like here in Douglas County. We're not exactly sure yet. Everyone's adapting a little bit differently to their communities, but we are working with them on our policy components, the statement of work, and all of that. So more to come on that. We were also able to recently wrap up some focus groups with the community to identify community needs around maternal child health policy to drive better outcomes in our community. So if you remember the Change Labs project that was undertaken with the board's equity committee, this is the second project that has come out of that. And so really we're looking at maternal child health outcomes, especially in our North Omaha area, knowing that our birth outcomes there tend to be quite a bit worse than in other parts of the community. So more to come on that as well, but I did want you to know that there was progress being made in a second project with that. We were also able to hold our first Regional Health Council Executive Board Leadership meeting. So as I told you last month, we were able to select an executive board of 3 individuals to basically provide some oversight since that group has grown significantly over the past couple of years. We had that first meeting just a couple of weeks ago. Actually, it was just a week ago, and laid out logistics for completing and disseminating the CHIP, which you should see mid-March. Leadership team building, which we think is going to be really important since this is kind of a new group. And just really figuring out what the future of the community health assessment will look like. So we may be looking at a different model. The past ones that we have done, at least since I've been here, have all been based on the Hospital Association's community health assessment model. I personally would love to see one that engages the community a little bit earlier in the process. So that's something that I'll be bringing up in that group, but we will hopefully be having lots of good conversations about potential models going forward, and we'll keep you apprised on that. Next week, I'll be participating with the city's Vision Zero Executive Committee, and I'm really looking forward to that. So that's a city effort to really bring down traffic-related deaths to 0 in the community. And I think that aligns really well with one of our community health improvement plan priorities, which is around transportation. Part of that is because we want people to have transportation to access the things that they need, but we want that to happen in a safe way. So that safety component is just extremely important, so I'm really looking forward to that. I also wanted to just quickly give you an update on the Rural Health Transformation Grant. You've probably heard a lot, seen maybe some stories about this in the news. There is a tranche of funding that is coming to the public health departments in Nebraska. We have submitted for 10 community health workers and a coordinator to kind of oversee the work of those community health workers. What that will look like in practice in terms of where all of those community health workers will go, we're still fleshing out. But I wanted to at least let you know that is moving forward. It's been a bit of a process, and I think that DHHS has their hands full with this grant and the size of funding that they're getting and kind of the requirements federally for it. If you are interested, Nebraska Public Media actually put out a pretty decent story that outlines where all of the funding for the Regional Health Transformation Program is going. There are a lot of different areas that this is touching, and so I would encourage you, I think it's most easily laid out, easy to understand format I've seen yet on that, so I'm just promoting that as a good source. And I think that is it for our updates. Do you have any questions at this time?
Any legislative bills that
We've got lots and lots of legislative bills. I am keeping my eye on the time, though, and not wanting to put you over too far. I can give you just a very quick update on a couple of ones of interest, if you will. So LB 203 did pass. It's already been signed by the governor. LB 203 was Senator Kauth's bill that placed additional restrictions on health department directors in their ability to issue community-wide DHMs. That really what came of that particular piece of legislation did not impact us so much as it did Lincoln Lancaster. So it really focused on language changes around city-county health departments. Really didn't change anything for us locally in terms of our process. So we were able, NALED, I should say, was able to work with Senator Kauth to improve some of the language in that bill. So we were very happy to have that ability to collaborate and make it a bill that took into account compromises on both sides. So that did pass. I think there have been efforts for that for a good 6 years now, and so it wasn't necessarily a surprise to us. LB 843 addresses SNAP benefits, and I did shoot you all an email with my letter of support just so you could see that. I intend to submit that later today. Just has to be in before 8 o'clock tomorrow morning. So I will be doing that when I get back to the office. And we definitely want to see SNAP benefits going where they need to go for the people who need to, who need those benefits. And the hearing for that will be on Thursday afternoon at 1:30. One other really great update is that Senator Hardin in the Health and Human Services Committee, he's the chair, was able to prioritize LB 913, which is the community health worker recognition bill. So essentially this bill would allow for DHHS to endorse programs that train community health workers. And with that, with community health workers coming out of a program that has that endorsement, they would basically have the standard training necessary for Medicaid and others to be comfortable being billed for those hours for if a clinic or an organization is using a community health worker in a clinical setting. Basically, you can bill for the time for that community health worker just like you would nurses and doctors and things like that. And so that will be very important for sustainability, and we're very grateful to Senator Hardin for his work in supporting us in that bill and for also prioritizing it, which was a wonderful surprise for us. That one, I am not sure off the top of my head when, let me see if I can tell you. Okay. So it's in, I believe it's in committee now, but it will be advancing. So that's excellent, excellent news. We're very excited about that. So far, we haven't had major funding concerns this time around. There are some bills that do impact the healthcare cash fund that we're keeping an eye on. There's some bills that impact other fundings that are kind of ancillary to us that we're keeping an eye on just for the health systems on the whole. But other than that, we expected to see vaccine bills, didn't see any vaccine bills this session, so we're really happy about that. Hearings will go through February 27th, and then it's just doing the work of getting legislation passed after that in this short session. All right.
Just want to follow up on the Rural Health Transformation Fund. When do you expect you'll have an answer on the grant application, and then would that be for the 5 years?
It is, and I don't know that for sure. Do we know when we're going to hear? We don't know when we're going to hear. Hopefully soon. There's a meeting. Yeah, there is a kickoff after this meeting. So my hope is that we'll know more after that meeting. So the state actually got more funding than what they applied for, and that required them to have to go back and kind of redo their budgets and narratives, which required the rest of us to go back and redo some of our budgets and narratives. So the process hasn't been extremely linear. There've been a lot of things that we've kind of had to go back and forth on, but I think we'll know for sure shortly.
Okay, thanks.
Yeah.
Any other questions? No?
I've got a
All right.
Questions?
Oh, you got one more?
Yep.
Okay.
Sorry, one more. Just because of the timing on the Medicaid work requirements, does the county offer any resources for folks, or are the community health workers helping community members with this process?
That's a good question. What would you have to say about that, Dr. Casanave? So certainly we want to be able to assist people, especially given that and the need to recertify more frequently. And there is a bill before the legislature right now that would basically take away the recertification. You wouldn't be able to certify any more frequently than what the federal requirements are, so that would be good. However, helping people through that process, I think, is going to be really important.
So we have two of our community health workers that are able to kind of assist with that. We've had, out of our 4 that we've had for community health workers, there just were some concerns for the requirements on our staff of what might be needed. But currently we just have the 2 that have kind of been assisting where they can, primarily within our refugee population as well.
All right. Any other questions? All right. Well, thank you for your
All right.
report.
Thank you all.
So item 6, is there any other questions on the department reports that were submitted? All right. Seeing none. So the next board meeting is going to be on Wednesday, March 18th. And then the committee meeting on the 4th Monday of the month. Next meeting is scheduled on the 24th. No need for executive session today. So can I get a motion to adjourn?
Second.
Second?
Who was the second? Okay, sorry. Okay. Wade,
Yes.
McNally, King, Festerson, Jones, Rogers, Espinoza, Wilkin, Weiss.
Great. Everybody have a great Wednesday.